If I dry up, my questioning and I can't, you step in. All right. You hold the microphone, okay? And as they're coming down, we'll catch them as we go along, okay? Well, we'll get these two ladies here. Excuse us. Morning. We're nurses from the local hospital. We're doing a project on anemia. We wondered what anemia means to you.
Well, lack of iron, lack of blood, sort of iron in the blood.
Right, thank you very much. Thank you.
Good morning. We're doing a project about anemia. I was wondering what it meant to you.
Well, I think shortage of blood, I think.
Not much.
You haven't had it at all?
It means too many white blood corpuscles as a rule.
Never had it at all?
No.
Oh, that's good.
And
All
I'm
right.
80 next week.
Oh, lovely. Thank
I don't
you.
think I've ever been ill.
I'm sorry, dear, I can't.
You don't know
I don't know anything about it.
Never had it?
Not that I know of.
Thank you very much.
Thank you.
I'm sorry, dear, I can't. I don't know anything about it.
Never had it?
Not that I know of.
Thank you very much. When we were given this project, we decided we'd find out from the general public what they knew about anemia. But as you can see from some of the replies we've had, they're very confused about it. But we as nurses must be sure that the patient understands.
Yes.
To ensure their patients do understand, and to be able to reassure them, nurses must themselves be fully informed. Their studies include anatomy, physiology, psychology, signs and symptoms of disease, mental and physical.
Can any of you think of any signs and symptoms of anemia?
Well, she'd be feeling tired all the time, wouldn't she?
Since she'd noticed this, particularly when she was doing her housework, she'd find it more difficult to cope.
There's the effects. Now, what about the causes? You remember from Dr. White's lecture that various investigations have to be carried out. Do you remember what...
Patience, kindness and understanding are the essential qualities needed for all nurses, and particularly for nursing the mentally handicapped.
Julie? Hello, Julie. Julie. Now, one of the basic needs of the mentally handicapped child is the need for love and security, which is actually a basic need for all children. And if we are not fulfilling this need for love and security, then we're failing in our duty as nurses.
A mentally handicapped child does not develop as quickly as other children and never attains the full mental capacity of a normal adult. Mentally handicapped children have difficulty in understanding and in communicating, but they respond to affection as other children do. In most cases, the causes of mental handicap are not known. It can result from conditions before or at birth, which affect the functioning of the brain. It cannot be cured, in the same sense as illness, but the development of mentally handicapped children can be improved considerably by nursing skills, training and special education. Occasionally, physical handicaps occur together with mental handicap, and such people must be helped in learning how to move about and to walk.
Come on, right up here. Come on, yes, right up here. Very good, right. Now turn round, turn round. Right round, turn round. That's it. Come on, right round. Good. Now walk back. That's it. Fine. Good boy.
Normal reflexes must be developed, even such basic ones as learning how to fall over without hurting oneself. Education for the mentally handicapped is not only a question of normal school activity, reading, writing, arithmetic, but more of developing the person's potential to live as full a life as possible. When children have very little power of concentration, working with them can be very tiring, and great patience is needed by teachers and nurses. But this makes a breakthrough or any progress all the more rewarding.
Mental handicap is sometimes wrongly confused with mental illness. Anyone can become mentally ill at any time of their life. We don't usually speak in terms of cures, but rather of helping the patient face the stresses of modern living.
Psychiatric nurses learn about their patients' minds as well as their bodies. They study the causes of their breakdowns and what treatments are likely to help them to recover.
Now, Mrs. Jones, why are you sitting here all on your own? All the others are having coffee.
And you haven't been in at all. You're completely isolated this morning. Do you always feel so depressed first thing in the mornings?
No.
You don't? Well, has anything happened to upset you this morning?
No.
Do you feel neglected?
Most of us take for granted such everyday things as working, earning, going home to the family, being able to fit into society. But there are people who may not be able to do these things because illness has isolated them and the problems of life have become just too much to cope with. Psychiatric treatment offers them the hope of a return to health or for their condition to be so improved that they can go back to family or community life.
I'll never get better.
But of course you will.
Psychiatry is a relatively young branch of medicine and much is not yet known. Research constantly reveals fresh knowledge. What is certain is that the relationship between patient and nurse is all important. Patients tend to relate closely to the nurse because that's the person they see most.
And to concentrate on getting your confidence and getting well again.
Is there to be equal representation between both?
At hospital policy meetings, the relationship between staff and patients is always under review. In this case, by members of the teaching staff and the chief nursing officer.
As you know, I have been discussing this whole question of the bond between the patient and the nurse, and I'm not happy that what is being taught is put into practice.
I think the ways of overcoming this would be to extend our care study system and involve the clinical teachers more in the wards.
Fair enough, Cliff, but we only have a limited number of clinical teachers.
There's rather more to it than this. There are the sisters and charge nurses that we must take into consideration, and also the nursing officers.
I think you should go and discuss this at your meetings and let me know what you decide. But I'm interested in your comment about care studies because I think this is perhaps one of the best ways of developing a relationship between patient and nurse.
The care study this week is a case of anxiety with depression. Mrs. Jones was one of Rod's patients and he will describe the case to you.
Thank you. Mrs. Jones is aged 40 and has 2 children, a boy and a girl.
How to bring the nurse nearer the patient, a constant aim of psychiatric treatment. One way is to encourage the student nurse to learn from his patient rather than from his textbook. When they've spent a period of time with a patient, students present a care study to fellow nurses and tutors as a basis for discussion.
Excuse me, what job was this?
She had quite a skilled job, actually. She worked as a machinist in a dress factory. Only the beginning of her problems came about 2 years ago when her son, who was aged 14 at the time, was arrested for breaking and entering and appeared before a juvenile court. Although his name didn't appear in the paper, somehow Mrs. Jones's workmates discovered this and began gossiping about it, and she felt obliged to leave this job, and since then she hasn't had a steady job. She's worked in several different places and has had financial worries because of this fact as well. Eventually, the anxiety that she developed became so bad that she was admitted to this hospital. And one of the first problems we had when she came in here was the fact that she didn't feel that she was really ill, although she was depressed and very anxious. She felt very guilty that she was taking the time of hospital staff.
There's nothing wrong with her, really. I really feel quite a fraud. I've never been ill in my life before, but I just get terribly depressed. I know it's awful to worry like this.
Oh, just come through here, Mrs. Jones, and we'll have a talk about it. Have a sit down and sit here. Now, I'm sure that we'll be able to help you while you're in this hospital. To make you feel more at home, I'll take you around and I'll introduce you to the other ladies on this ward. Now, most of them are only here for a short time, and I'm sure that you'll soon make some friends among them. You'll also find that there are very few restrictions in the building, and that you can come and go more or less as you please. Now, in about half an hour, the doctor will arrive on the ward, and he'll understand all about your problems that you've got, and he'll also tell you all about the treatment that you'll be receiving.
Can you tell me in your own words what the problem is?
Well, I've been feeling ever so depressed lately.
These factors, the fact that Mrs. Jones had been removed from a troublesome home environment, the ward discussion groups, and also the medication that she'd been prescribed, all helped to improve her condition considerably, even up to 2 weeks after her admission.
What sort of medication was she on?
Mrs. Jones was prescribed diazepam 5 milligrams twice daily. This was to relieve the symptoms of her anxiety. But her condition had improved so considerably just before her discharge that this was discontinued.
Are you feeling better?
Oh, very much better now, thank you, Doctor.
I'm very glad about that. Now, the next phase in your treatment is to prepare you for your discharge, which won't be very long now. I should like you to go to the Industrial Rehabilitation Unit here in the hospital grounds.
Oh.
This will help you to get into the habit of mixing and working with people again.
See? Linda, Jerry. It's quite a simple operation. All you've got to do is pack 3 to a pack.
Oh, done this before.
Good.
In the treatment of mental illness, a new concept has come into being recently. This is to treat people in day hospitals rather than having them live in. Day hospitals enable people to preserve their sense of identity as members of their families and their communities. In group psychotherapy, patients can compare themselves with others, which is an important adjusting mechanism that operates in all of us. The nurses are not identified by wearing uniform in this treatment, as they are an integral part of the group. Their job is to encourage, stimulate or provoke discussion, sometimes just to sit and listen, always to be able to ascertain and analyze problems as they arise.
Well, in the intervals, I don't feel 100%.
I'm sorry I'm late, sister.
I wonder why you were late, because, was it because the buses were too full?
No, it wasn't that. It was just that I got a panic attack while I was waiting at the bus stop, and 2 or 3 buses went by before I could get on.
Oh, gosh, I used to be like that. I've had exactly the same feeling. The staff nurse very kindly offered to accompany me until I gained confidence. I'm sure you'd find help if it could be arranged. Do you remember?
This is quite true, you know. I did travel with you for a short while until such time as you were able to gain your confidence.
Well, let's make the same arrangements with you, perhaps accompanying Donald to the day hospital and see if it would help him, as you live quite near. Do you think it would help, Donald?
Well, I think it would, and for a week or so, perhaps just...
Nowadays, we don't admit patients to a psychiatric hospital unless it's absolutely necessary. We tend to treat them in the day hospitals or in the community, which is the setting of their illness, or even in their own homes. Take this place, for example. The patients come here from 9:30 to 4:30 and then go home, so that they are relieved of some of the pressures, and some of them are still with them. They are not isolated for a period and then thrown back into the situation which may have caused their illness. We're able to provide a much better service for these people by using the informal approach. We don't wear a uniform. And of course, the link between the hospital and the community makes the nurses' work far more interesting.
Patients and their families often prefer treatment to be at home, where this is medically and socially possible. So nurses from psychiatric and general hospitals go out and work in the community. This service is offered in cooperation with the community nursing services.
How long have you been a student nurse? Oh, I've been nursing about 18 months now. Oh, really? Well, you have some conception of how the patient is nursed at home after they leave hospital?
Yes, we've been learning about community care with our tutors. As a matter of fact, I'm quite looking forward to seeing how people are nursed at home.
Medical group practices welcome this close liaison with hospital staff.
Come in. Hello, Alan. Come and sit down. I'm just going over today's list. One of the things we must sort out is Mrs. Dixon.
Oh, yes. Is she still hearing voices?
Well, I've had another call from the neighbours. They say she's still shouting and throwing the cutlery about. I went to see her the day before yesterday, put her on some tablets of meprobamate. What I really want to know is whether these have made any difference to the situation.
I see.
Can you go back today and check her response?
She's in here.
Thank you. Hello, Mrs.
Oh,
Dixon.
hello.
And how are you today?
Oh, I'm not too bad at all, thank you.
Good. I understand the doctor left you some new tablets when he came
Oh,
last.
yes, he did. I think they're good.
Do you?
Yeah.
And how often do you take them?
Oh, 3 times a day.
What's the matter with the television? Why is it facing the wall?
Oh, there's nothing the matter with it. They told me this morning that the man in there could see me when I was undressing. I didn't like that at all.
No, of course not.
So I turned it round.
Yes.
Couldn't
Are
see
these,
him then.
are these the voices that told you to throw your ornaments and your cutlery around?
Oh, of course. But they don't tell me to do so many things now as they used to.
Good. I'm glad to hear that.
I have a very varied list of patients today we have to visit. Our first one, Mrs. Walters, is a multiple sclerosis.
Is she bedridden?
Yes, she is now. She has been for the last 4 years, having had the illness for 20 years. But we do go in daily and give her family support and nursing care.
Come in.
Good afternoon, Mrs. Walter. How are you today?
Sister. I'm feeling a little better today.
This is Nurse Gordon from the hospital.
Good afternoon.
She's come out to help me.
Oh, yes.
We've brought the helping hand I told you about yesterday.
Yes.
Perhaps you'd like to see how it works.
Yes.
You press that trigger. See? It's like a
Yes.
gun. Like that. I'll show you.
Oh, yes.
There we are.
Now you try and see how you
Yes,
get
I'd
on.
like to. Thank you very
Ready?
much. Yes, thank you.
Excellent. That should make life a little easier for you,
Yes, it
shouldn't
would
it?
be most helpful.
Treating patients in their own homes also helps to keep beds available for people who need intensive hospital care.
What's Synodov?
This is leads attached to your chest, and it's attached to this oscilloscope here, which will tell us your heartbeat and your rhythm.
Just what your heart is doing.
No, it won't turn at all.
Quick, cardiac arrest. Call the team.
If the heart stops beating, there are only about 4 minutes in which resuscitation procedures can save the patient.
Switchboard. Cardiac arrest, ward 7.
Excuse me, please.
Cardiac arrest, ward 7. Hello, technician.
Dr. Kirby?
Anti-baby. Infusion ready? Where would you like?
Let's put the machine next.
Okay, Karen.
I'll take the laryngoscope, please.
You all right? Give me time. Okay. May I have half a litre of 8.4% bicarbonate and an ampule of adrenaline, please?
Jotting down the drugs.
Adrenaline going in now.
Heart's beating normally.
Blood pressure.
Good pulse. There's a good heartbeat.
Sinus rhythm,
What's the rate, please, Miss Gray?
60 per minute.
Yeah. It's got a good pulse. Everything seems
Blood
okay.
pressure 100/60.
Fine.
Oh, yes, I'm feeling much better. Yes, it was a couple of days ago. Yes,
This
they're
patient's
looking
life was saved thanks to prompt and efficient action by the nursing team. Nursing, It's a job for people who care.
3 liters a day at least.
And I'm quite looking forward to seeing how the patients are looked after at home.
And once after supper, when I go to bed, if I've forgotten the message.
It takes time. Just try and be a little bit patient with yourself.
Yes,
Occupy yourself doing things that might interest you. Get back to work again.
I'm sure that we'll be able to help you while you're in the hospital.
Gio, come on, walk towards me. Come on. That's fine. Good. Come on, that's it. Very good.
Tip it upside down, Jackie. Put it on the draining board. Jackie, on the draining board. That's it. Upside down. Put these in the sink, Jackie. In the sink. That's it.